and welcome to Health Talk. My name is Carrie, and with us today is Barbara Walker, a registered nurse and certified diabetes educator. Today we're going to be talking about diabetes complications. In previous segments, the importance of controlling diabetes to help improve one's present health and to prevent complications later was mentioned. Who is at risk for developing complications from diabetes?
Actually, anyone with diabetes is at risk for developing the complications. And when we talk about the complications, we have acute complications, which occur in a relatively short period of time, and chronic or long-term complications, which occur over months to years. There's three main types of diabetes: pre-diabetes, which we used to call borderline; type 1 diabetes, which was formerly called juvenile diabetes; and type 2, which was called adult onset diabetes. All three of these categories can develop complications depending on their blood glucose level and their overall blood glucose control.
You use the term acute and chronic complications. What is the difference?
Acute complications come on very, very quickly, a matter of minutes to a matter of hours. The two main types of acute complications are high blood sugar and low blood sugar reactions, known as hyperglycemia and hypoglycemia. The chronic complications are long-term complications, and these are generally seen when a person overall has poorer diabetes control. These chronic complications affect our blood vessels and the nerves.
Can the complications be delayed or prevented?
Yes. What we know now through multiple studies is by keeping the diabetes under control, that means the A1C level is less than 7%, or the average glucose is under 154, we know that we can decrease the risk of complications by as much as 75%.
Please review what the A1C is.
The A1C tells us over the past 3 months what the person's average blood sugar has been 24 hours a day, 7 days a week. When this test is done at the doctor's office, it's reported to the patient as a percentage. We like to have the A1C under 7% because we know that's where we're going to decrease our risk of complications. When a person's testing their blood glucose at home, they don't get their numbers in a percent. So we can compare the two numbers by using the estimated average glucose. So an A1C less than 7% means the person's average glucose is under 154.
What are the statistics for developing complications from uncontrolled diabetes?
Unfortunately, for as much as we know about diabetes, it is still the leading cause in the United States of blindness, amputation, and people needing to begin dialysis. It is the 6th leading cause of death in the United States, and while people worry that they could die from their blood sugars being too high or too low suddenly, the #1 cause of death for a person with diabetes is cardiovascular disease, a heart attack or a stroke.
Why is that? What causes the heart attack?
What happens is the lining of the blood vessels become clogged with cholesterol, fat plaques. So there's not as much room for oxygen-rich blood to flow to get to the heart muscle. Also, the blood vessel itself can become diseased, which prevents the oxygen-rich blood from reaching the heart. When the muscle doesn't have enough oxygen, a piece of the heart muscle actually starts to die, and that's what causes the heart attack.
Please talk in more detail about the complications from diabetes.
First, we'll talk about the acute complications, or the short-term ones.
Okay.
I like to think of them as they come on more quickly, and that's how we want to take care of them. The first one, and the one that usually concerns most people with diabetes, is hypoglycemia. That means low blood glucose. For most people, they feel like their blood glucose is too low when it is under a level of 70 milligrams per deciliter. And they will experience symptoms. Their body will tell them that there's a problem. People feel shaky, sweaty, weak, difficult concentrating. They feel like their heart is pounding in their chest. Sometimes even vision changes and lack of concentration. Basically, what's happening is your body's running out of gas. Our food is our gas, so when people are having a low blood glucose reaction, we encourage them to eat something that's going to absorb into the system quickly, like a half a cup of juice or a half a cup of sugar soda. A tablespoon of honey, table sugar, or maple syrup will do the trick. 6 to 8 lifesavers. Chew them up and swallow them. We also have prepared glucose tablets. And depending on the brand that the person buys, you would eat 3 or 4 of these tablets, and it would help raise the person's blood sugar as much as 50 points in about 15 minutes. We also have this as a gelatin, and it also comes in a liquid as well. So if a person is feeling weak or shaky, we encourage them to test their blood sugar. If the blood sugar is less than 70, or if they're having very severe symptoms, we want them to eat. About 15 or 20 minutes after they eat, we have them retest the blood sugar to make sure indeed it is on its way back up again. If it's not, we're going to encourage them to eat some more. And then once again, retest in 15 minutes. Once you're feeling better and on your way, we do recommend that you do have a snack to keep the blood sugar up in the acceptable level so that you're feeling good and can get on with your day. Now, if someone is having a severe low blood sugar reaction where you're unable to get them to eat or drink anything, we tell you to dial 911. The medical professionals that ride the ambulances are trained on how to treat a low blood glucose reaction. With certain people with diabetes, we can actually train family members on how to administer glucagon. This is just for a severe low blood glucose reaction where the person actually loses consciousness. And by administering this as a shot, it helps wake the person up so that they can eat or drink and get their blood glucose back up again. A lot of people with diabetes are very fearful of having a low blood glucose reaction. But I have to be honest. Our goal is to keep your blood glucose within the range of someone without diabetes. So it's possible that you will have a low blood sugar reaction. And if you have one from time to time, that's okay. But if you're having 1 or more a week, that's too many. And you need to contact your physician or your diabetes educator to try to look at what you're doing during the day. Are you skipping meals? Are you exercising more than usual? Taking too much medication? We need to help you figure out why are we having so many low blood glucose reactions. The second acute complication is hyperglycemia. That means a blood glucose above the normal range. And this can happen for lots of reasons. If a person's not following their meal plan and eating too many carbohydrates, cookies, candies, cakes, pies, this can make the blood sugar go up. If they're under stress or illness, this can make a person's blood glucose go up. Lots of different things. So when the person is testing their blood sugar on a daily basis, they can watch for patterns or trends. If their blood glucose had been ranging 110, 120, 130, now they're 160, 170, 180, this is a problem. So we have them look at their blood glucose numbers and try to figure out why is this number trending up. If you can't, we encourage you to call your healthcare professional. If you're coming down with an illness, this is going to make the blood glucose go up. You may need some antibiotics. So hyperglycemia is just the other side of the coin from hypoglycemia. And generally, people do feel different when the sugars are higher. They're more tired, their mouth is dry, they're urinating more often, they're not sleeping well, maybe even having leg cramps or nightmares.
Now, you mentioned that amputation is a huge concern for people with diabetes. Can you explain that?
Amputation is one of the chronic or long-term complications that can happen for people with diabetes. What can happen is, just like we talked about the blood vessels leading to the heart can become diseased, the blood vessels leading to the legs can also become diseased. And by the time our blood vessels get down into our feet and toes, they're quite small. So if the blood glucose level is high, the vessel itself gets diseased. It's difficult for healthy oxygen-rich blood to travel through, and people can also have nerve damage associated with diabetes. So if a person has a blister or a sore on their toe, they may not feel it, so it could become infected very, very quickly, and that infection, if we can't treat it and heal it, can end up with an amputation.
Now, you have a diagram of a kidney here.
Mm-hmm.
Are there complications related to the kidneys with diabetes?
Yes. The long-term complications with diabetes are broken down into 3 categories. We look at large blood vessel disease, small blood vessel disease, and nerve disease. The large blood vessel disease is what leads to heart attacks and strokes. Also can lead to damage in our lower and upper extremities. It's called peripheral arterial disease. So the blood vessels become narrowed, they're not carrying the oxygen-rich blood, and our heart, brain or leg muscles or arm muscles are actually being damaged by not enough oxygen. And people have symptoms when they're having a heart attack. Most people know the symptoms of a heart attack are chest discomfort. It may radiate to the neck, jaw, shoulders, arms, the middle of the back. May feel sweaty, sick to the stomach, and short of breath. Symptoms of a stroke are usually located on one side of the body or the other. May result in blindness, difficulty speaking, weakness on one side or the other. Peripheral arterial disease is a little more sneaky. People will complain of fatigue and muscle soreness when they're walking, or they'll complain in their arms when they're trying to do things above their head. And once they stop, the discomfort goes away. That's because when you're resting, your muscles don't need oxygen, so the symptoms go away. So that's a little more sneaky. The thing about heart attack, stroke, and peripheral arterial disease is these things can be easily evaluated. An EKG can tell us if there's a problem with the circulation in your heart, or a stress test. With a stroke, we can do a Doppler or an ultrasound, like we do ultrasounds on babies. We can look at the blood vessels in the neck and into the brain to see if there's slowing of the blood flow to the brain. And with the arms and legs, we use blood pressure cuffs. No needles. Very simple test. The small blood vessel disease are what affect the person with diabetes kidneys and their eyes. The kidney disease is called diabetic nephropathy. The nephron is the part of the kidney that filters our blood. That's what our kidneys are. They're filters. And their job is to keep the good things in our body and let the bad things out. Once the blood vessels and filters get damaged in our kidney, the kidneys will start to let the good things out of our body as well, and that's protein. So one of the easiest ways to tell if there's kidney damage for a person with diabetes is with a urine sample. So everyone with diabetes every year should be giving their physician a urine sample. The eye disease is called diabetic retinopathy. The retina, or the back surface of the eye, is where we see, and the blood vessels on the back part of the eye become diseased. They can become bulging, they can actually burst, and there's bleeding into the back of the eye. So when people have diabetes, it's recommended that they have a yearly dilated eye exam by a professional who's trained to do a diabetes eye exam. To dilate your pupils, they put drops in your eyes, and the pupils get very large, which makes it easy for the physician to see onto the retina. The nerve damage is called neuropathy. And most people think of neuropathy when we think of a person's feet with diabetes: numbness, tingling, pain, a burning sensation. But we have nerves in every part of our body, so we can have neuropathy in every part of our body. We think of it with the feet because that's where it usually happens first. We can also have it in hands. We can have neuropathy in a person's stomach. So when a person with diabetes eats their foods, if they have neuropathy of the stomach, it's called gastroparesis. The food doesn't go through the system like it should. So people don't absorb their food properly, they're malnourished, they have a lot of nausea and vomiting. So gastroparesis affects the nerves of our stomach. We can have nerve damage of our sexual organs. There's commercials on television all the time for erectile dysfunction. And approximately 75% of all men with diabetes have some level of ED, but also 55% of all women have some sort of sexual dysfunction related to uncontrolled diabetes. So it literally affects us from the tips of our heads to the tips of our toes. The nice thing, if you can say a nice thing about complications, is by having an EKG, having a stress test, giving your doctor a urine sample, checking your feet every day, we can help prevent or delay the onset of these complications. And isn't that the real goal?
Is the neuropathy reversible?
Not always. If the neuropathy is caught early and we get good control over the blood glucose, sometimes the neuropathy can be reversed. Luckily, we now do have medications to help treat neuropathic pain. We didn't have those before. We thought that once you were there, that was it. So now we do have medications. Capsaicin cream, Lyrica, is very commonly used for fibromyalgia pain, but as well as diabetic neuropathy pain. We used to think kidney damage was permanent, but we now know that by using certain blood pressure pills, we can protect the kidney from damage from diabetes, but we can also reverse kidney damage. So if a person is told by their doctor, you have protein in your urine, their next question should be, when do I see the specialist?
That's all the time we have for today. For more information on diabetes, visit us at www.ogh.org. We look forward to seeing you next time on Health Talk.
Diabetes education classes are offered at Olean General Hospital. For more information, please call 716-375-4127.